Nausea and vomiting are extremely common, affecting almost 30% of the population each year. Nausea is the sensation, the urge to vomit. And vomiting is the forceful expulsion of stomach contents through the mouth. Generally, vomiting is protective and can protect us when harmful substances or toxins are ingested. And nausea is like a warning sign of vomiting.
Nausea is extremely common during pregnancy because the main hormone of pregnancy, human chorionic gonadotropin, increases the sensitivity of the gastrointestinal system. It is also protective because the fetus at early pregnancy is especially sensitive to toxins and infections, and nausea had an evolutionary role to protect the baby. Many infections also cause nausea and vomiting. For example, during the common cold or viral enteritis, where the main symptoms are nausea, vomiting, and diarrhea. In this case, either the viruses or microbes directly infect the stomach and guts, causing irritation, or they cause inflammation. And these inflammatory molecules activate the vomiting center in the brain.
And during stress, some people experience nausea and vomiting due to blood supply reduction to the stomach and intestines. On the other hand, an increase in adrenaline, dopamine, and serotonin can stimulate the vomiting center. Another common cause of nausea and vomiting is motion sickness. When visual and sensory information from the inner ear doesn't match, it can activate the vomiting center, which is extremely common in children while traveling. Food poisoning, acid reflux, and gastric ulcer. Any irritation of the stomach, inflammation, and infection can cause vomiting. On the other hand, medications are common causes, especially painkillers, antibiotics, and chemotherapy drugs can stimulate the chemoreceptor trigger zone in the brain.
The tumors in the brain, if they increase intracranial pressure, can cause nausea and vomiting. Now let's say about treatment. One of the most effective treatments are dopamine antagonists such as domperidone and metoclopramide, because the main stimulant of vomiting is dopamine. Although dopamine reduction can cause movement problems if treatment is prolonged. That's why they are used for the short term in case of gastroparesis, migraines, and pregnancy-related nausea. Standard treatment usually is no more than 5 days.
Another effective treatment is histamine receptor antagonist, which reduce histamine levels and block signal transmission to the vomiting center. Such medications are dimenhydrinate, meclizine, and diphenhydramine. They are used in case of motion sickness, vertigo, and inner ear disorders such as Meniere's disease. They are more effective in acute cases for rapid symptom relief, but they cause drowsiness and sedation. Their usage long-term is not recommended because they can cause cognitive decline and dementia. Another commonly used medication is anticholinergics such as scopolamine, which is more commonly used as a transdermal patch. It's perfect for traveling during motion sickness or postoperative nausea.
Ginger has anti-inflammatory properties which modulate serotonin receptors in the gut. It also improves gastric motility, and it is effective for mild nausea in case of pregnancy, motion sickness, and postoperative. Hydration and electrolyte intake are crucial in case of vomiting is present. It's crucial for restoring fluid and electrolyte balance. For chemotherapy-induced nausea, serotonin receptor antagonists are used, such as ondansetron and They are effective in the early stage of nausea. They can cause constipation, headache, and arrhythmias in some cases.